BK Kim, Mike Gibson coming to you live from ACC 2026. And BK, you're going to talk to us about South Korea and what is the right LDL target among people who've had an event. This is secondary prevention in South Korea. Tell us what you found.
Mm. Okay, so actually, recent guideline has recommended LDL cholesterol target is less than 55. So it's a quite general concept. However, in daily practice, until there was some gap, meaning the previous LDL cholesterol less than 70 versus 55. In Korea is also some kind of a doubt. However, definitely a guideline has mandated. However, there is some remained some gap between the clinical practice and guideline recommendation.
So tell me what you did and what you found.
Pardon?
What did you do? Tell us about your analysis
Uh-huh.
and what you found.
Uh, okay. So actually, our EGPF trial, as I previously mentioned, so we sought to evaluate two LDL cholesterol target for patients with ASCVD less than 55 intensive targeting. So and then versus less than 70 is a conventional targeting. So we compared these two targets per patient with ASCVD by the randomized clinical trial pattern.
Wow, so your randomized people had different targets.
Right.
And what happened? Who had better outcomes?
Okay. So actually, our patient is 3,048 patient with ASCVD was randomly assigned to the intensive targeting versus uh, conventional targeting. And also we compared the primary endpoint, composite endpoint at 3 years. Our primary endpoint composite cardiovascular death, non-fatal MI, non-fatal stroke, any revascularization or hospitalization uh, for unstable angina. So during the 3-year follow-up, the first median LDL cholesterol level was 56 in the intensive group and 66 in the conventional group. So primary endpoint, composite endpoint is 9.7 in conventional group and 6.6 patient with the intensive group is intensive targeting significantly reduced the risk of primary endpoint. Among individual events, non-fatal MI occurred less frequently in intensive targeting group. So as everybody can expect, any revascularization, including PCI and CABG, is also significantly reduced. So interestingly, the fatal event, meaning the composite of cardiovascular death, MI, stroke, was also significantly lower in intensive targeting group as compared to the conventional targeting group. That is the main
We,
finding of our trial. Mhm.
yeah, usually we look at a graph and
Mhm.
we say lower is better,
Right.
you know?
Hmm.
But you randomized
Hmm.
people to this versus this.
Right.
And you found that targeting a lower LDL
Hmm.
was better.
Right.
So it's not just looking at the relationship math.
Hmm.
You really randomize people, which is very, very interesting. And I always kind of think lower is better.
Hmm.
Uh, were there any differences in side effects?
Right.
No
Uh,
difference?
yeah, so we also evaluated the safety endpoint. So
Mhm.
some new onset diabetes or statin-associated muscle symptom, elevation of lab abnormality. However, there was very similar between the group, especially the uh, creatinine elevation is more beneficial in intensive targeting group.
Wow. Okay. So more effective, lower is better in terms of being more effective, but equally safe.
Right,
Very good.
right.
Well, this is, I want people may not realize how interesting and important this is. You really did randomize to different targets, which
Hmm.
is very unique and important in terms of causal mechanisms. Congratulations on your work, BK. Great
Okay.
job.
Thank you. Thank you. Thank you very much.
Thanks for joining us, and thanks to everyone for joining us here from ACC
Uh,
2026.